The masseter originates the zygomatic arch and inserts the angle of the ramus of the mandible. The buccinators originate the maxilla and the mandible and insert at the lips. Zygomaticus major originates the zygomatic bone and inserts at the fascia at the corner of the mouth and upper lip. There's a difference in action between this and zygomaticus minor, where zygomaticus major elevates and draws the corner of the mouth laterally, and zygomaticus minor protrudes the upper lip. The origin of zygomaticus minor is the zygomatic bone, and it inserts at the fascia at the corner of the mouth and upper lip. The procerus originates the frontalis and inserts the skin between the eyebrows. Frontalis originates the galea aponeurosis and inserts at the skin superior to the eyebrows. Occipitalis originates the galea aponeurosis and inserts at the superior nuchal line of the occiput. Orbicularis oculi originates the orbital margin and inserts at the eyelid. Orbicularis oris originates the maxilla, the mandible, the lips, and the buccinators, and inserts the mucous membrane and muscles inserting into the lips. The platysma originates the fascia of the superior pectoralis major and inserts the base of the mandible and skin of the lower portion of the face. Sternocleidomastoid originates the superior aspect of the manubrium and medial third of the clavicle and inserts at the mastoid process. Anterior scalene originates the transverse process of C3 through 6 and inserts at the first rib. The middle scalene originates the transverse process of C2 through 7 and inserts at the first rib. The posterior scalene originates the transverse process of C6 through 7 and inserts at the second rib. The sternohyoid originates the superior aspect of the manubrium and inserts at the hyoid bone. The sternothyroid originates the posterior surface of the manubrium and inserts at the oblique line of the thyroid cartilage. Omohyoid originates the superior border of the scapula and inserts at the hyoid bone. Thyrohyoid originates the oblique line of the thyroid cartilage and inserts at the hyoid bone. Digastric originates the mastoid process and inserts the inferior border of the mandible through the hyoid fascia. Stylohyoid originates the styloid process and inserts at the hyoid bone. Mylohyoid originates the posterior aspect of the inferior mandible and inserts at the hyoid bone. Geniohyoid originates the posterior aspect of the inferior mandible and inserts at the hyoid bone. I decided to throw this slide in to show just how many muscles are on the interior of the mouth and make up the bottom of your mouth, just below the tongue and around the cheeks, just inside the teeth alone. Here we've got two muscles that are probable only inside the mouth. The medial pterygoid originates the medial surface of the pterygoid plate of the sphenoid bone and tuberosity of the maxilla, and inserts the medial surface of the ramus of the mandible. Next is the lateral pterygoid, which originates the infratemporal surface and crest of the greater wing of the sphenoid bone and lateral surface of the pterygoid plate. Its insertion is the articular disc and capsule of the temporomandibular joint and the neck of the mandible. Thanks for watching.